Nation, Guru Nation, Guru Nation, Guru Nation. Guru Nation, thank you so much for watching. Make sure you like, subscribe, comment, share if you're listening. Also, the links to everyone on here will be on the show notes to their LinkedIn. All right, this is a very special episode. We have a CRA Academy grad, Rick Young, who's in here. He just finished. Which course were you in? The January?
I was in the January course.
January 23 course.
I was in the January course.
So he came out, went into shadow, but he got hired before the internship ever started because he hustled and he found this man, Terrell, who needs no introduction. You've been on the podcast before, but remotely. You lit up the Zoom interview like no other. I mean, I did this Zoom. I do podcasts with people all the time on Zoom. The one we did, I left energized. I was like, this dude, I don't know if it's the glasses or like the stuff he's saying. I was ready to run through a wall for you, man.
Yes.
So I can tell you've got a lot of characteristics that we're going to try to unpack here for this pod, especially as they relate to life sciences. And then Marvin, who's brand new to research, but is from a very disruptive industry of tech.
Yes.
Software.
Yep.
And you're probably looking at our industry like, what the heck is going on?
Yeah, there's a lot of exciting things that I'm learning. Obviously, this is my first time being on a clinical
That's a nice
side.
pivot.
Yeah, and your team is great, and you made us feel welcomed, and I feel like
Shout out to
coming
Chris.
out of here, I'm going to learn a lot.
Really?
So, yes.
What
I'm
did
learning
you
a
like?
lot.
What was your biggest takeaway from the day?
I think my biggest takeaway is the one that I asked you the question about, like when considering a site for clinical trials, right? The location is one of them, like accessibility to the diversity of, the people who can participate in clinical trials, like Native Americans, whites, etc., Latinos, etc. So yeah, I mean that's one great aha moment for me, and I think seeing your people in the ground doing the actual work kind of adds to that rich experience.
Yeah,
for
these
me.
are the ones doing the work. Shout out to people like Grecia,
Yes.
who's camera shy, but she gets on every now and then. Terrell,
Yes, sir.
Numa, what was the idea for this? There's obviously a lot of inefficiencies. We've kind of touched on some of these during our podcast, but maybe we can explore a little bit more.
Yeah, for
some
sure.
of these inefficiencies and maybe what you've learned so far too.
Yeah, absolutely. So I'll first start by talking about the inefficiencies. I come from pretty much a very similar background as Marvin. Just happened to make the switch sooner and with a little bit more tenure. And so there's a lot of things that we figured out in the software industry as far as how to get teams of people to behave and perform better. And the life science industry, pharmaceuticals in particular, is about 15 years behind as far as those modern ways of organizing and orchestrating work and activating people to get the work done. And so as we got deeper into this journey, I was thinking to myself, who else would I be able to bring into this picture? And they go, oh, I see exactly what you mean. So Marvin is someone that I worked with. I actually coached Marvin
Yes.
At two companies that he worked for. The first company, I was a consultant helping them explore better ways of working. And then the second one, he landed at the company and he was like, dude, you got to come out here. You got to talk to my boss.
You recommended him for that new company.
Yes.
I was
Gotcha.
18 back then, so.
So this dude, Terrell, no matter what industry,
Yes.
he'll
Yes.
come in and figure out what needs to be changed and how to fix it.
Absolutely, because I think where we come from is agile project management. The skills, the discipline, the values are kind of portable.
Agile.
Yes,
I've heard that 3 times today. Like, what does it mean?
Yeah, so it's a way of attacking work more bottom up than top down. I mean, and the way I'm going to explain it is going to sound very common sense, so please bear with
Right.
me.
All right.
But we lose our common sense inside large organizations.
We do.
Right.
We get into why later too. I want to get into.
So
that.
we'll take the work, a big chunk of work, and then we'll chop it up into pieces and then chunk it out over X number of weeks. So we have this big thing that needs to be done. It's a big, massive 3-year plan. We take that, chop it up into quarterly plans. Take those, chop those up into monthly plans, and then chop those up into week plans. And when I say week plans, I don't mean, hey, I'm going to be working on this thing from this week all the way up until June. It's like, no, chop it up to specifically what is it that you're going to deliver for that week. That's a piece of that thing over time. You take that, you can divide stuff up horizontally over time.
Yeah.
You can also divide it up vertically over different team members. Think
like
if we
that.
needed to write this book, and this book had 10 chapters. One way is Dan slaves over all 10 chapters. Another way is Dan outlines, hey, these are the goals. These are what I want the user to take away from each of these chapters. And then each one of your 10 team members goes and makes the first draft of that. You come in and you do the quality control. This is okay, this is okay, this is okay. Change this, change this, change this. All right, guys, go and take another week at this. But within 2 weeks, you're already getting to the second draft of the book.
Yes.
Now, you might need to do 5 or 6 more of those iterations, as we call them, but you can see the picture now, dividing work that way horizontally over time and then vertically over people, and then iterating on it where you do a quick first cut, and then you figure out, how do we make this just a little bit better? It may still take you a full year to write that book, but you've done 52 iterations of improvement over those 10 chapters.
Wow.
It's going to be a phenomenal book. Chances are you'll probably get that book written in 12 weeks if you did it in this way.
Wow.
So take that and expand it over, say, a clinical trial, a global clinical trial. Multiple people, multiple countries, multiple sites. Divide up the work horizontally over time, divide it up vertically. In large
You know what?
organizations, it's over like hundreds of people that we're dividing up the work.
It makes so much sense. I think that sites do this naturally well, especially the smaller the sites, the better.
Yes.
It's like I didn't know what Agile means, but as you're describing it, like that's literally all we do. We
Yes.
have daily goals, even with Get SCL. Like while we were waiting for you, we're like, hey, who's coming Wednesday? Who's coming Thursday?
Right.
Who's coming Friday?
Mhm.
Like, let's get them in scheduled. Like
Right.
those are our weekly goals, daily goals.
Exactly.
I mean, we're doing that already.
Yeah.
But the
Yes.
bigger organizations, even the bigger sites, I think money, having an abundance of money,
Yes.
prevents that pragmatic approach.
I agree
Because
with you.
money buys you time, it's a luxury,
Mhm.
and then that time gets wasted,
Mm-hmm.
and then you end up in these situations where you need to rally and the team to come in and say, look, you guys need to simplify this. What the heck are you guys
Right.
doing?
I say the big difference, the delta that I see between big companies and small companies, you're the entrepreneur, you're the founder, you're the leader, you're working side by side with your team. So if there's any ambiguity about what's priority for the day, hey, Dan, just to make sure this is
Yeah.
priority for the day, right?
Yeah.
Right, cool. Now, take what I just said about chopping stuff up over time and then over people. Now add, I don't know, 6 layers of management between the average
Right.
clinical research associate from the sponsor side and the VP of clinical operations who owns that portfolio.
And
of
by the way,
studies.
all of those people are trying to protect their job, not necessarily do what's right for the business.
Exactly.
Yep.
Exactly. And they tend to, do the thing that they've always been told to do.
Safe.
Yes.
What will not get me
What
fired,
will not get me in trouble.
but will still keep me here.
Right.
And no one's really going to care as long as we don't run out of money and we have a good amount of money.
Yes.
And the status
at big
quo will
companies,
eventually
there's
catch up.
places to hide, right? At Yuma Clinical Trials,
There's
you're
nowhere to hide.
Right.
This
so,
is
if,
right there.
so if somebody's not pulling their weight, it's obvious,
Yeah.
right?
Yeah.
At a big company
Nowhere to
where
hide.
there's 200 people helping pull through a trial, there's people that you literally wonder, what do they do exactly?
Or never met.
Or never
or
met,
never
or
met.
never
Or
respond to
talked to them.
emails.
Yeah, or never respond to emails.
Yes.
Never
after
respond to
email,
emails.
after
Yeah.
email.
So, Dr. Young,
Big
I think
one.
you have a unique perspective on this, if I may, Dan.
Yeah. Please.
So you come from the military.
I do.
Which is a large organization.
It is.
And most of what we know about leading people in large organizations comes from what we learned from the military.
Mhm.
United States military in World War II, industrialized prior to
Yeah.
that, all the way back to Roman times.
Right.
If you need to organize a bunch of knuckleheads to be effective at getting something done, you have leaders who lead groups of people, and those groups have leaders on down and down.
Right.
So you've seen A, the military,
Mm-hmm.
B, Numa, right?
Mhm.
Very small company. And then
Right.
C, our clients.
Mhm.
Would love to hear some of your observations about where the disconnects happen and why they can't do this very simple thing. If you get 6 people together around a table and say we need to get something done, what will come out is Agile. So Agile is codified common sense that you reteach to people at big companies. So you've seen the big
Right.
company thing.
Right.
You've seen how we do it internally. You've heard Dan talk about it anecdotally, and
Right.
you've seen how it's done in the military. What do you think goes wrong at these large organizations as far as keeping people aligned and coordinated and actually making them effective?
Yeah, so that's an interesting observation because in the military, it's exactly as you described. It's a large organization that can be almost personified as a city because each base is like a city, right? And there's top management and it trickles all the way down to the E1. And then that's the military in general. But then you have these special groups and they're called either special warfare or special forces, and they work agile. They work amongst each other. They make their own decisions within the group. Even teams of instructors, they worked within the group and they make decisions on the fly. But you don't make the decisions on the fly as an entirety of the U.S. military. The general will look at strategy, then it goes down to whoever the XO or the CO is, and then it goes down to the first shirt, which then it goes down to the squad leaders, which then goes down to the team leaders, and then it's just this huge pyramid structure. And unlike big pharma that I've had the opportunity to both work for as an Abbott and then work for as work with as our client, AbbVie, is interesting because in the military, you can't throw money at a problem, right? You can't do the same things that a large organization can. And so the problem still exists is that you have individuals in the higher ranks that are disconnected from what's going down in the trenches, and there's no conduit. There's no liaison that is allowing this information to go from one side over to the other side. And worse, what I see is that even though the leaders may have a vision, the individuals that are engaging in executing on that vision, they don't really know what the vision is of the leaders, and they're unable to come to a consensus amongst the group to move forward, even in the decisions that they make.
So I have a follow-on question.
Yeah.
In the military, how do they get that bottom-up information flow?
So in the military, it's really simple because there's ramifications, right, for doing things that are against orders, right? So you have a very small team. It usually exists of about 8 people, and you have a leader. And so what you use a chain of command.
Got it.
Okay.
And so if you don't know what you need to do, and you're in E1, you go to the E3, right? And if you're in E3 and you don't know what to do, you go to the E5, and then and up and up and up. And then they usually have actual titles that they're given so that you know who to go to. But that's how it works in the military. So if you're E1 and you're no smarter than the Baccarocs, well, you know where to go. You go to the E2. And if they don't know, then you go to the E3, and et cetera, et cetera. Yeah. So simple with open door policies, and things get done. But with pharma, maybe not so much.
Well, I think in the military, especially in war, like this chain of command makes sense, but teaching people how to operate autonomously within the confines of their role is important, because if you get 2 targets, I mean, you got to pick one, or you're going to be the target, right? And you don't have time to go ask, well, what do I do? You're trained to do something. Whereas in our industry, the timelines are not that urgent. They might seem urgent, but urgent might be 3 months from now.
Yep.
Right? And maybe like a week from now, you need to send a report somewhere. The stakes are not as high as in war.
Right.
So I think time and money kind of just complicate things, and there's no bigger example of this than pharma. From what I mean, I'm biased because this is all I know.
Right.
But as a site owner and operator, like where we're forced to eat what we catch,
Right.
Agile makes sense to me, even though I never heard about it until today.
Right.
Yeah.
Right.
But Dan, the thing is that when you're talking about the consequences are the same in pharma as they are in the military, because what is going to happen is loss of life. It's just that in pharma, it takes a lot longer.
It's slow
Yeah.
motion.
It's a lot longer because disease doesn't kill you as fast as a bullet does.
Right.
But we're still talking about life.
Yeah, I mean, the stakes are high, right? But I
Yeah.
think in comparison with Agile in the military, right, one of the things, the values that we are advocating for Agile is collaboration, right? In the military, I've heard, chain of commands, which is all good and respected. But in Agile, we're trying to break that barriers, right? We're advocating for more collaboration, both vertically from the people ground up to the manager to the director level, and even to the VPs.
So you're
and
talking
also
just one company?
across- Yes. Yeah.
Okay.
And also across multiple teams. We're trying to break silos by promoting and advocating collaboration and, working together. So that's what
So-
Agile brings to the table.
So that's within one company. Now imagine throwing in clinical research
Yep.
an extra two stakeholder, the CRO.
Ah.
Now you got the sites. Now you got all the vendors.
Yes.
Right.
So how do you foster that communication amongst
That's
separate
what-
companies?
Yeah, that's one of the things we're working on, because that one is not as easy for a nut to crack, especially when there's a financial transaction involved.
Right.
So we can all talk about, we want to work with the ecosystem, we want to work with the partners, we want to be a good partner, et cetera, et cetera. But the moment I'm paying you, you are now a vendor. And I'm not talking about my personal philosophy. I'm telling you about the switch that tends to flip, because now this is procurement. Now this is a cost. How do we mitigate against this cost? We mitigate against this cost by having very strict guidelines for performance against that contract. Now, strict guidelines for performance against a contract is not a good place to start collaboration.
Right.
Right?
Because
Because
we don't
now-
feel like team members.
Exactly.
We feel
It's
like
carrot-
boss.
Exactly. It's
worker.
carrot and stick. It's
Yeah.
boss and worker. So, like, on paper, I'm these guys' boss. The reality is we all succeed and fail together.
Yep.
I pay them because that was part of the agreement. But when we're having conversations about what needs to get done, I have to come into this as these are my partners, because I can't figure everything out on my own.
Yeah.
And so I consider it a privilege that these guys allow me to pay them, and they choose to give their time to building this particular vision, because these are two very smart, hardworking guys that could be anywhere doing anything, right? So I think just the whole philosophy of where that interaction starts from the place of transaction, therefore contractual obligation, therefore legal's involved, procurement's involved, finance involved, accounting is involved, all the bean counters and non-collaborative, the number people rather than the people are now involved, and that's the starting place. Now, we talk to lots of teams that are involved either in site management, right? Think about that name, site management, not site partnership or site
Right,
collaboration.
site management.
Most sponsors call it site management because the sites are something to be managed. You manage things, you collaborate or lead people, right? So if you and I are supposed to be working together,
So we're a thing.
yeah, so I'm not going to be
We're a
like,
thing.
I'm going out
We're
to
things.
I'm going out to manage Yuma clinical trials. Like, no, I'm going out there to collaborate. I'm out here to
Right.
teach. I'm out here to learn. I'm out here to see what's happening. I'm in here to see what your world is like. So that's the start. That should be where the starting place is, but that's not where the
But
starting
I'll
place
tell you
is.
why these big pharma think that way, though.
Yes, sir.
Everyone's got their hand out when they see big pharma.
Yep.
Like all 15 vendor. New study is announced,
Yep.
especially phase 3. 30 vendors come out of nowhere. Not sites, just vendors.
Yeah, yep,
Here, give me. This is what I do. This is what I do.
100%.
So they've got to be somewhat jaded. And then they put people in these places to manage that
Right.
process, right?
To manage the process,
Yeah.
not to build a relationship.
Not to build. But
But
some
at
them
the end of
are-
the day, I think, if you have your list of trusted partners, then when it's time to kick off a new study, you can quickly separate the signal from the noise because you have real relationships with real partners. And let's just say, for the sake of argument, you're like, I'm not sure if we can take it because there's all this other stuff going on. But for you, I'm going to see what we can do. because you've always done right by me. I want to do right by you. Yes, you pay me. That's just part of the deal. But at the end of the day, it's all about people trying their best to do right by each other, so that when there is a slip up or there is a miss or there is a delay in payment, you can call me up. Hey, man.
So reciprocity is still a thing, regardless
100%.
of the.
At the end of the day, it all comes down to the humans on both sides of that transaction. Start with the human first interactions. Everything else we can take care of. Good relationships make good business. And something that I've heard anecdotally from people is on the sponsor side, and this is kind of grapevine talk, but they're basically like, a lot of these therapeutic areas are getting very crowded and very competitive. Yeah. And so there was already starting to become murmurs of, okay, how do we work better with sites? How do we be more competitive? How do we be the partner of choice if, you're running three different studies in the same TA that you're attempting to recruit for? Who do you go with?
Who do we go with? Me and Gracie ultimately make the decision. Put this patient in that one and put that one in this one. Everyone thinks, we present everything to the patients.
Right.
They decide. Usually it's the clinician who decides, like, hey, I think these three studies, especially if they're the same TA, therapeutic area, it boils down to people like me and Gracie.
Absolutely.
I think you're better off in this one.
Yeah. And it's getting to the point where at least some of the larger CROs are going back to the sponsors and being like, love working with you guys, but you're too slow. Here's how we interact with other sponsors. Here's where you are. So people are starting to put together scorecards for sponsors in terms
Dr.
of
Fox
their
is doing
Yeah, I know. That's what I was just thinking.
My boy, Dr. Fox.
Your guy. Shout out to Dr. Fox.
Yeah.
Slow down on the memes, Fox. He's the best. But yeah, he got a PEC score for every sponsor. And when I brought up Eli Lilly, he's like, oh yeah, I can confirm they are highest on that list, or one of the highest. So like the nerds also confirm what I'm coming up with anecdotally. And I don't work with all the big pharma, but from my experiences so far, like, that's a very pleasant surprise.
Very nice. Very nice.
Yeah, that really is the difference between site management and site partnership.
Exactly.
And I feel bad we have deviations all the time. I mean, we have new staff. We're busy. Deviation's going to happen, right? I feel extra bad when it's their study. I do. Okay. And I'll go out of my way to make a CAPA plan, even if I don't have to.
Sure.
I just go out of my way to clean up their study because I know, like, they're treating me well. Reciprocity, I got to do my best for them. And everyone else, it's like,
you mentioned
transactional.
Reciprocity, right? I think having that kind of level of relationship, there's almost like a feeling of shared ownership, right? And accountability. And I think that's exactly what you're describing. As you have established this relationship, if you will, you feel sorry and bad if something goes bad with your partner / business partner, if you will, right? So there's some sense of shared ownership and accountability, I think.
I think that's what we need, and I think the magic is figuring out, and that's what you guys do best, is cracking this code for the big companies out there.
Yes.
As best we can. And you can see, even though Marvin has only been working with us for a few months, a lot of what he knows, a lot of the lessons that he learned in coaching different kinds of organizations, he's already starting to be able to lift and shift, and it's literally the same kinds of problems.
And if you're a small site or a site and you're watching this, you're not immune either, because a lot of sites treat their employees as transactional. I could pull out my phone right now. This guy's been texting me, my other coordinator from my other site. He works at a bigger site. They got bought by some conglomerate. He's texting me today, hey, man, I'm sick and tired working here. These people treat me like crap. And this is a master's degree rater. He feels the same way as I feel as a site for these sponsors.
The help. They treat you like the help.
Transactional, not relationship. And one of the things I try to do is have relationship with the staff. Hey, Gracia, you need to be honest. Tell me what you want to do in the next 5 years. I'll help you get there, even if it means you don't work here anymore.
And
then she feels a certain way hey, if she feels I'm being genuine,
Yep.
she's going to go out of her way to do a good job.
Right.
I mean, to me, it's common sense, but a lot of
It
these
is.
sites
Yes,
out
it
there are
does.
not
It is.
operating like this.
Well, and a lot of people don't know how to build relationships.
Right.
Right. Everybody knows me from being online and people who interact with me personally. It's like I have a very specific style, and people are like, oh, yeah, I remember that guy, the guy
Yep.
with the glasses. But even outside of that, I have to build a relationship with these guys. I can't
Yes.
just be like, go do, which is why I was like, hey, guys, let's go to Yuma because
And Rick's been saying nothing but good things about you.
Good.
Oh my God.
99% of the time.
Is
I
it
know what
because
kind of
it's
guy you are
recorded?
based off of Rick. Based off of lunch with Rick.
Rick's a saint, man. Rick's a saint. But my point is, like, when we do stuff like this, like last night we went to dinner, we went out to
Right.
drinks. When we go to travel to other client sites, we try to fit in things to actually build a relationship
Right.
among each other. So, for example, I know Dr. Young is very interested in understanding the MSL role.
Yep.
And I told him the same thing that you told her, which is, let me know what you're trying to do. Let's figure out a way to get there. In the meantime, let's focus on those skills that will get you closer. So with one
Right.
client, there's a person that we're working with, one of the work streams is basically all about medical affairs and MSLs. So I'm like, hey, Dr. Young, I'm running this work stream, but I'm going to invite you to all the meetings so you can get some exposure and build relationships with these people, because I think, you know, at the end of the day, this is a relationship business. You could easily find the side door into medical affairs through your relationships, even
Right.
though you've never had MSL on your resume. So by the same token, I know that this guy is destined for bigger and better things. I'm just glad he decided to join me for the part of the journey that he's going to join me for.
Yeah.
But I'm Team Rick just as much as Rick is Team Numa. I'm like,
Yep.
what are we trying to do? Oh,
Yep.
you're trying to be an MSL? Okay, well, here's the MSLs I know, and here's who we're going to talk to. Remember, we started
Yeah.
setting up calls
Yeah.
with people I knew and, like, you know, kind of doing
That
informational
was that was
interviews.
really
Right.
early.
Yeah.
On.
But I wanted to let you know.
Yeah.
This is before you even started working.
Yeah,
for
yeah,
me.
no, we
I
weren't-
was letting you know that when I say, yeah, I want to support you in doing that. That's what I mean.
Yeah.
Like, you know, you working
we
for
had
me
a
or not
call.
aside.
Yeah, we
Right,
had a
right.
call. I wasn't even working with Terrell, but we had a MS Teams call, I think it was, or a Zoom call, and I was on it, and it was some guy. I don't even remember who it was, but it was somebody that who had a comfortable living. Let's just say.
Yeah.
And I was just there as a fly on the wall, as an observer, getting exposure to this theater.
Yeah.
And watching Terrell do his magic, and having a conversation, building a relationship with
Yep.
this individual, so that he could execute on something down the pipeline with this guy. But it was in
Yep.
medical affairs,
Right.
based upon about 200 conversations that I had with MSLs, and a discovery that I came upon when having these conversations, because a general theme kept on coming up that they didn't like. Like, oh yeah, I like this, and this, but I like this and this, but, and I shared that with Terrell, and Terrell's like, there might be an opportunity here. So, but that might be executable at some juncture down the pipe.
It will be.
But
Right. And I said, I would love
Yeah.
to help you develop that. Let's talk to some MSLs and see how they react to it. And we can start
Yeah.
incubating these ideas.
yeah, but then the world caught fire, and
Yeah.
and now here we are.
Here we are.
Yes.
Yeah, I think I want to add something.
Please
when,
do,
When
Marvin.
we talk about the relationship building, how important it is, I think you can mention at a high level, there is the relationship building with your vendor, and there's also the relationship building with your staff, with your employees
With
in
your
the
team,
company,
yeah.
right? And coming in first time on a clinical site, site, I was impressed by your team, and I say this with all sincerity.
Wow.
That when I came in there, everybody seemed to be happy. They're having fun, and obviously they know what they're doing, because they even did it like. I don't think that's planned, right? They did the test like on right there, right?
Yeah.
And I think that's very important that you actually establish the kind of environment that fosters that psychological safety, if you will. And then also, while we were brainstorming about your grand vision of having new sites, etc., people are welcome and they feel safe to actually express their ideas,
Yeah,
right?
yeah.
So I think that's one of the values or practices in Agile that we are trying to foster. So you've been doing it without you calling it Agile, but establishing that psychological safe environment where people can actually express their ideas and then be part of the solution, right, is one thing that we are advocating for. So kudos to you as their leader and your team. They're having fun. And in Agile, we always say that the best results come from happy and motivated teams. And I see it like firsthand.
Wow.
Mm-hmm.
Thank you.
You're welcome.
That's what we try to go for. I mean,
And keep in mind, Dan, a lot of times when we crash land at a company, a lot of what we're doing is leadership observations.
Right,
A lot of what
right.
we're doing
you guys here to audit me.
Yeah.
watching. Well, we're nerds about it, so
Passing so far.
we naturally pick up on it. We're basically
Right.
picking up on the vibe and the emotional connection between the people, because that's really where team effectiveness starts. People literally being connected to each other, like feeling like family,
Right.
feeling like this person has my back. So subconsciously or consciously, as we walk around
Yeah.
and see you interacting and just hearing the conversations we're having with you and your staff just feeling free to jump in and contribute. It wasn't like, oh, the big boss is talking to
Yes.
strangers. It was just like,
They're like, oh yeah, I'll move
I
down
know,
to
right?
Tijuana. Let's do this.
I know.
right.
We even
So,
talked about
we're about to
tacos and
start
all that,
start up
right?
a site in
Yeah.
San Diego
Might
and
as
steal
well.
your staff
Let's
and
do
the whole
it.
thing. But no, that's really cool because it makes me/us feel like for today we're part
Correct.
of your team. Like we can just sit around and chop it up like real live humans.
Yeah.
You know, your staff included. Nobody feels all tight or like
Right.
they have to act a certain kind of way.
But is
Right.
it possible to keep that? Because I think in a small business, first of all, if you're running a small site and you don't do that, like I don't know what's wrong with you. It's not that hard with a small team.
sure.
The challenge is when they get bigger.
Yes.
Do you think it's possible, or do you think it's idealistic, and like a large organization?
A little bit of both. You just have to be a lot more intentional about it. So what a lot of companies do is they'll hire somebody with a lot of leadership experience, and that person's job will be like community manager.
Right.
What do? They arrange fun Fridays once a quarter. They figure out what's going to happen with the holiday party.
Right.
They figure out everybody's birthday to make sure we get bagels in the office that day. And the things that I'm talking about are really small and by themselves inconsequential. But if you think about, for example, many years ago I worked at Yahoo. Yahoo at the time had 20,000 employees, right? But I felt like a team with my team, and we had an admin, and between the admin and my boss, they basically had a whole roster of like team connection and community activities, and they had a budget for it. And I asked Sonia, the admin, one day, I was like, so how much do you spend on all of this stuff? Because the break room was like a 7-Eleven where you didn't have to pay. Pretty much anything you needed from, sugary snacks, healthy snacks, V8, juice, the whole nine. We would get catered meals once a week. We would get, all the perks that you would get from a tech company. And I asked her, how much does this cost? She said, we make an initial budget of $100 per person when they get hired, and then it's an ongoing $17 a month per person for all these
That's
perks.
it.
$17 a month.
Very practical.
Very practical. But if you imagine a team of 15 people, $17, right? That's $250. $250 back in those days, back in the olden times, y'all. Back in those days, $250, that was, hey guys, we're going to cut out at noon today and go watch the new Star Wars movie. That's, hey, we're going to order $30 worth of bagels every week just so you have something to look forward to. It's a bunch of little small things.
Yes.
But the point is it was thoughtful and it was intentional. So I think in larger organizations, if you were like the VP of clinical operations at a big sponsor, it would be unrealistic to expect you to be able to lead that whole organization and be the community manager. Right now, because it's a small organization, you can do that. You can be both head cheerleader and head coach.
Right.
As it gets bigger, leaders usually retain that responsibility of being head coach, but they don't typically have support on the cheerleading and community building aspect. So that's the part that has to be intentional. Some people do it by hiring someone, and it's a paid, mid-level manager role of community manager. Some people tell folks, hey, allocate 10% of your time to joining the community planning committee, whatever. mixed results on
And
that
there's
one.
people who take that stuff seriously too.
They do.
Yep.
They do. And I was actually talking to one of our clients about
Yep.
the list of priorities on their list of things to do. And one of hers was, oh, I'm part of the parking committee. This is a company in the Northeast where parking is, a big deal. They don't have infinite wide open space like you do here in Yuma. And she was like, no, this is a real priority because we have some things we need to solve before we break for Christmas. And so I could tell just by how she talked about it that it was serious to her. It was serious for her. And you want those passionate people who are passionate about the holiday party or passionate about the company retreat or passionate about whatever and actually build that into the operating model of the company. Not as a if we have time or budget allowing, but a fundamental part of it, no different than getting everybody a laptop.
It's interesting because, there's these jets that are flying out here, these Marine Corps jets.
We take for granted now, but
Right. And I was saying they are so cool. They're like literally out. You could see the pilots.
I'll be doing a Zoom right here, and like a jet's just hovering down, landing.
Right.
I'm just like having a conversation on Zoom, like just staring at it.
There's
Like,
one.
You're
just
so
passed.
close to them. The flight line is like literally. You could
That's
right
right here,
throw
right
a stone. You
Yeah.
could throw a stone, but in the Marine Corps, it's unit, core, God, country, and they teach it, right? So from the beginning, where your priorities stand, and so you need to know that your unit is the most important thing. You're not selfish. Like
I see.
you're not one person. You're part of a team.
A unit.
First and foremost, you are part of a unit, and without you in this unit, it breaks down. And so when leaders engage in that and they're a part of it, then you become a family, right? I'm part of this unit, and these people are important to me, or this project is important to me, this parking is important to me. And so when you take that ownership that you were
Yep.
talking about, things really do start changing.
Yeah.
And I think they took ownership of the sites. Eli Lilly took ownership of like, we really need to have a relationship with these sites. And when you take ownerships, you become part of that unit.
and that was intentional.
Yeah.
Yes.
And then the arguments, well, they're the biggest market cap pharma. They should be able to do that. Well,
You have
that's
to
besides the point.
Yeah, it is besides the point because you have to make a decision to do it,
Yeah, it's still intentional.
and then ingrain it into
and
your
the other
culture.
ones are not really doing it from my experiences. So they got to be, we got to give them their flowers when they're here.
Yes.
Switching gears real quick
Yep.
to wrap up. By the way, everyone's LinkedIn's underneath. You have a LinkedIn too, right?
I will connect
Oh.
you with you.
Okay, we'll
Yeah.
put everyone on there.
Sure.
I think I'm following you.
Yeah, I think
Yeah,
you
I
are.
think I
I just
am.
tagged you on YouTube.
I think I may
Nice.
have like left maybe 100 or 150 comments or something.
Oh wow!
Some,
Thank you.
over
thank
the
you.
course of
I
months.
appreciate it. Shout out
Yeah.
to the CRA Academy. We
Sure.
really so happy when our students do well in the real world. Big shout out to you, Rick, for doing that and showing like with a PhD, this guy goes out there and hustles his way to get a job as if he doesn't have any degree. Like a lot of people that with PhDs or even masters, they're like, no, that's beneath me.
Yep.
Somebody should come find
And
me.
and
Oh,
that's what made my brain click.
Yeah.
Dude,
Right.
you did all the work necessary in your military career, right? What did you do in the military, Dr. Young?
Well, ultimately, I became an instructor.
Yeah, but,
But-
the hot shit you used to do.
Jump out of planes.
Yeah. Well, so the SEER schoolhouse is it's a school that's intended to prepare people that have high risk of capture from being isolated. So essentially, special forces and pilots.
Right. So this
and
guy
so
was
it's part of the spec ops of the Air Force.
So let me recap. PhD, spec ops instructor in the military,
Yep.
eager, hardworking, and willing to start from the ground level.
Correct.
He said, I don't know anything about consulting. I was like, I can teach you the consulting part. What I can't teach is what you've already shown me.
Yeah.
That you're just willing.
The last thing you probably wanted was another consultant. Hey, I got to do consulting for this XYZ. That's probably
Yeah.
the opposite of what you wanted.
There's pros and cons, right? Sometimes you just need somebody who can go in and do the thing. But as far as the philosophy behind the company I'm trying to build,
Yep.
I want to be able to take people from industry. and train them up on how to do the work that we do.
Yep.
I want to take people from other industries that have an idea of what we do and show them how we do it here in this business. And the same thing with Dr. Young. I want to be able to take pretty much anybody who's willing to work hard and hustle and help make them successful. Because I can work with hustle. If we all hustle, we will all succeed.
Yeah.
The skills, we'll learn that on the go, right?
Yeah.
This is the very team-oriented environment. We teach each other stuff all the time.
Right.
What I can't teach you is how to hustle. So
That's
if
my
you already
philosophy
have that, we
with
can
these
work with you.
these guys
Very
too.
good.
Everyone that got hired is capable of that.
You can't teach personality, but you can teach. You can teach science all day long.
Right,
That's
right.
right.
Yeah.
Mhm.
So last thing I want to get into, because the whole sticky note thing is like
Yep.
really a thing for you guys, right?
Yes, very
Yes.
Can you,
Yes.
can you break it down? We don't have that
Sure.
many stickies around
Yeah.
here.
Yeah.
That'll
So I-
change.
I apologize.
That'll change.
So I'll explain it to you this way. Earlier, I talked about breaking down a problem horizontally over time and then vertically over people. Oftentimes, the part that needs to happen before that is thinking, what is it that we need to actually do?
Right.
Figuring out what are the to-dos. So these sticky notes are a way to get people to visually think together, meaning everybody writes down what's on their mind, and we go through these different sets of exercises to either combine the information into different categories or take the information and split out so we can prioritize what's
Right.
important and what's not. We use that to build any sort of go-forward plans. And making things visual means that you don't have to have a separate meeting to bring people along. The four of us were involved in concocting the idea and the strategy for what it is we were doing. So when it comes across your desk as a PowerPoint, you kind of go, oh yeah, I remember we talked about that, right? So codifying it and formalizing it is different from the ideation and the collaboration necessary to get the information in the first place. So the sticky notes are a way to allow teams to collaboratively solve problems. Most of the problems that our clients need to solve are cross-functional problems, meaning you need someone from pharmacokinetics, and you need someone from safety, and you need someone from ClinDev, and you need someone from ClinOps, and you need someone from patient recruitment. These are people who all come from different worlds that need to come together to solve a problem. They all have different backgrounds and perspectives, and so you can't rely on, we all know what we're talking about, right? Right? We all have the same idea, right? Right? And if you do, it turns into those never-ending meetings where you just discuss. At the end of the day, what makes an effective team is the ability to take action, make a decision, and move forward. Having a way to visualize what's in everybody's mind so you can organize and arrange the information so that you end up with a go-forward plan is a big part of the sticky notes. It's a muscle, if you will, that we teach teams how to use instead of just sitting in meetings staring at each other all day.
And in addition to that, in addition to the benefit of visualizing work, if you will, the other thing is in Agile, we are a big believer of, responding to change over following a plan. Say, for example, you have a year-long plan that's represented, each of the activity by a sticky note, right? You can still visualize that one. It's good to have a plan. We always encourage that. But due to emergent information, you can easily, move things around, right? So if one precedes the other, and then based on the emergent information, the sequence changes, you can easily pivot as a result of, that emergent information. So that's another thing, because you can freely and easily move things around, responding to emergent information and change.
And quickly.
Yep.
And there's an
quickly.
aspect of having people stand up and think together
Yep.
and physically manipulate the information that has a completely different set of cognitive benefits compared to sitting around at a meeting.
Right.
Is
The
that-
other one, which I don't want to forget, when you have the visualization of work, there is a sense of co-ownership among everyone that's involved in the board, right? So
Yeah.
we co-own this.
Especially if you see it, you say, that sticky I put there.
Yes.
Right?
Yes.
There's some, but can this be done remotely too?
Yeah, you
Yes.
can.
Yeah, we do
it all
We
the
have
time.
tools
We-
that.
Yeah.
Yeah.
We have a board that looks just like a whiteboard
Yes.
with stickies on that Marvin usually facilitates from LA. And
Yes.
Right.
us two, knuckleheads
Yeah.
will be doing it from our
Yes.
locations. But it's a board, and we're doing it remotely. But we're doing it at the same time
Yeah, it's real
And,
time.
Yeah, it's in real time. We're
Yeah.
doing it.
You think sites can do that? Anyone can do that.
Anyone
Anybody,
can do it.
anybody can
Yes.
do it.
And it's not just what we tell our clients; it's how we work too.
Yeah.
Right,
You know,
right.
'cause, we found it to be extremely effective in making sure that everybody's aligned, and then you have a go
That's
forward.
very cool.
Yes.
I feel like a lot of the stuff you guys do, I mean, I don't know, maybe I'm generalizing, but a lot of these companies that are too big
Mm-hmm.
for their own good that have like 10 managers
Yep.
between the CEO and the workers, a lot of them could have thought of this too. Maybe they're afraid to execute it because their
Mhm.
job is on the
Mhm.
line, so it's safer to like, hey, let's hire Numa.
Mm-hmm.
Is there a lot of that happening? Like,
Yeah, I
hey,
mean, I
know
think
you like this sticky no. Like, if I hire you, you can do it, and I don't like risk losing my job.
there's a little bit of that. I'll give you two cases, right? Case one is going to be the savvy leaders. A savvy leader looks around and says, my team needs something. And every single person on my team already has a 40-hour-a-week job. I'm smart, so I'm going to get experts to help build this capability inside my team, right? So that's a smart use of consultants, not necessarily just to do the work, but to teach your team how to work in this way. Case number two would be, oh man, consultants are expensive. I'll just tell Sally to do it. Well,
Yeah.
Sally already has a 40-hour-a-week job that if she doesn't do a good job at, she'll probably get fired. And so she looks at this extracurricular activity that boss man just dropped on her desk and says, all right, I'll do what needs to get done, but what I'm judged on, what I get promoted based on, what I get a raise based on, is my core job.
Correct.
So that's a case where it's penny wise and pound foolish because you're not going to get the results that you want. You're not going to get an expert that actually knows how to apply this to your work. You're going to get somebody who's going to Google or go to ChatGPT and muddle through and do their best. But that's very different than professional facilitation and professional coaching.
Mic drop.
Perfect.
There you go.
Speechless. Well, thank you guys for coming out here. I really appreciate it. Everybody go connect on LinkedIn. We have everyone's LinkedIn underneath this video or in the show notes. It's really good to get fresh perspectives. And
Yeah, and thanks so much for the invitation, Dan.
yeah, thank
Yeah,
you guys.
thanks for
coming
having
out.
us.
Thank you. It's very good experience for me. First time experience. So
Wow.
it's
First
very
time
good.
at site?
It's first time on a site.
Wow.
And seeing things in action and your team having fun and really delivering the job.
Two
So,
patient visits.
Kudos
too.
to you.
Not bad.
that's
yeah.
Thank you guys. I appreciate it.
Thank you.
Everybody like, subscribe, comment, share, go connect. Bye-bye. Hey, if you guys like that kind of content, make sure you like, subscribe, comment, share. Stay tuned for more videos.